Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise for those of you with hip and knee arthritis to be able to train the legs and strengthen the hip and knee joints, known as the lengthened split squat. Hope you enjoy. So for those of you with hip and knee arthritis, many times using compound exercises, meaning exercises that use multiple joints like our hip and knee together, such as squatting, such as lunging, such as leg pressing at the gym, is a bit too much because it creates compression. It creates flexion on the knee and hip joint. More bend puts more pressure on the cartilage, the inside lining called the synovium, and even the hip and knee joint capsules. So there's an exercise known as the lengthened split squat that decreases those stresses. And the lengthened split squat is done by taking a stance so that your middle foot and knee are directly above the mid portion of your thigh, and then bringing one foot straight forward and one foot backwards. When you do this, the more that you lengthen out from front to back, as you descend, there's going to be less overall motion in your hip and knee joints compared to having the legs close together in a normal split squat or lunge. So as it's lengthened, and you can hold on for a little balance when you're doing this, and slowing down the cadence or the speed that you go up and down, you're creating a lot of stress on the glute medius, which is the main hip muscle for hip stabilization that's lost to many people with hip arthritis, as well as training the legs to help stabilize the knee, correcting any type of RPI you have in that knee. If either the knee, front or back, has a lateral tracking patella, tense that kneecap in. If you have a tendency to rotate your knee in and out, internal or external rotation, tense it back towards the midline. If you're not sure what your unique mechanical distortions are, go to the Posture Size or painfreeandfit.com website. We've got a free body analysis. Check yourself out there and plug those into these exercises. Remember, generic exercises many times strengthen dysfunction. Specific targeted exercises help improve proper function. So when you're doing these split squats, the key things to watch out for are that the front hip doesn't hip hike or come up. You want to swing that down so both hips are level. The front leg and the back leg should be pointed straight with the kneecap tracking in direct line with the foot. And as you're coming up and down, you're using a slow cadence, not fast. Because it's a small range of motion exercise, you want to increase the stress to the muscles by going slowly. 3 seconds down, 3 seconds up, eventually 5, 10, even 15 up and down will help to really target and burn those legs and hip muscles, giving you a great workout without overcompressing the hip or knee joint. This is a great exercise to do just with your body weight. You can use extra weight, but again, when we're dealing with hip and knee arthritis, many times using body weight as opposed to extra weight is a lot easier on those joints without aggravating them. I hope you enjoyed this series on hip and knee arthritis using split squats. If you'd like to share this information with others, help me get the word out there for those who are suffering that think they can't work out, give me a thumbs up below. Questions or comments, write in. I'll be delighted to answer them. And remember, we have many programs to help you if you're suffering from hip and knee arthritis on our painfreeandfit.com website.